Hello, welcome. This is the MBLEx review course. My name is Jody Scholes, and I am your instructor for the MBLEx review course for the Massage and Bodywork Licensing Exam Prep course. So welcome. So glad to have you here. Today, we are talking about medical terminology, healthcare terminology. And that is a broad and wide spectrum of things to cover. But we're gonna dig down. We're gonna show you how to understand healthcare terminology. Yes, and our class is going to be in three parts. One, the first part is a test-taking strategy, giving you some information about how to approach the exam or how to approach your studying. So it's strategy. The second part is our learning. Yes, and we're going to dive deep into some words today. Yes, healthcare terminology, also called medical. Healthcare terminology, also called medical terminology. All right. And then the third part, we are going to dissect questions. Oh, let's get in there. Let's do it. Yeah. So, first part of class, this strategy. I wanted to give you just some strategy over the next 3 weeks on what you're studying and what we'll be doing in live class. So today we're doing healthcare terminology. Next week was members' choice, and we have a result of the poll. Doo-doo-doo, doo-doo-doo-doo. Dissecting questions. Dissecting questions won. Not by a landslide, but by a vote of 24 to the highest votes were for 24. And then pathology was a close second with 20. And then benefits and physiological effects of massage came in third with 16 votes. So what we're going to do is we're going to dissect questions mostly about pathology and the benefits and physiological effects of massage. That's going to be class all next Thursday. Yeah. We're just going to go crazy with dissecting these questions, getting to the best answer. So I'm excited because it's one of my favorite parts of class. I mean, I love to see the light bulbs go off when you see the best answer and you're like, yeah. So that's next Thursday. And it is the end of our first quarter. Can you believe it? The end of our first quarter. And so I want to mention, just because it's also the end of something else. Today is the spring equinox. Yeah, it's the first day of spring. So we have also ended the winter, and even though it might still be chilly where you are, we have begun the spring. And that is a beautiful time of self-reflection, of more hopefulness. And I don't know about you, but over the last couple weeks, there just seems to have been a little bit of heaviness around my circle of influence, around me, a circle of influence. And so it's so nice to recognize the the spring equinox, meaning the first day of spring, uh, and and just the hope that that brings for warmer temperatures, better weather, all the things. So wanted to just mention that at the end of our first quarter here, where it's also today happens to be the first day of spring. So next week, dissecting the questions. And then you actually get the following Thursday off. But you may wonder, what should I do? Well, what you're going to be doing is, or what you have the opportunity to do, what you're invited to do, is join the Alumni Business Roundtable on Monday. So on Monday, March 31st, 12 to 2 is the Business Roundtable. It's for the alumni. Normally you have to have passed the MBLEx to go because it's for alumni. But I'm inviting you. Come and see, come and hear the guest speakers. Uh, we have a business panel of 3 massage therapists who are currently working who graduated from this program, who are currently working, who are going to tell you, are going to answer specific questions that we've given them in advance to let you know what does it look like to be an entrepreneur, to be an employee. So, very exciting panel. We also, as I mentioned, have guest speakers, and we will also have a very special announcement that you are going to love that impacts your dashboard in the online learning center. I can't say anything more than that. But there's a special announcement coming Monday, March 31st, and it's going to change the way your dashboard looks. Yes. Okay. So that's what's going on for you over the next couple of weeks. Officially, we are off on April 3rd. So you can review tapes, you can still study, or you can take a day off. We're 12 weeks into this, into the new year. And so you may be feeling like, hey, I'm ready for a day off. Rest is important. And with the dates that I just gave you, I also want to mention that rest is an essential part of your success. I've spoken with many of you, and I know you're working full time, 2 jobs, hustling, really just getting yourself ready to be financially successful. You're doing what you need to do now for your finances to be successful as a licensed massage therapist. Maybe you're squirreling away money. I love it. But I know you're hustling. What I don't know is how well you sleep. And some people struggle to sleep. The mind just keeps working. But I want to be super clear. Rest is essential to your success. Research has shown that without proper rest, you can't lose weight. Right. Who knew, right? Proper rest is essential for your brain to be at its best. And so, what's one little thing you could do to improve your sleep? And that doesn't happen overnight. Just drinking tea at the end of the day doesn't always work. But there are little things you can do to impact your sleep. What would it feel like to leave your phone in the kitchen? Oh, Jody, I used that for my alarm clock. Okay, maybe get an alarm clock. I know. So there are little things that you can do. You can set a go to bed time. You can set a get up time. I know. It's crazy. The things that we used to be so upset about as kids now can serve us as adults. Okay, 10 o'clock, time to go to bed. 8 o'clock, time to go to bed. Depends what time you got to get up, right? Simply, I just want to remind you that rest is an important part of your success. And so once a quarter, we take a rest. Once a quarter, we take a Thursday off and just rest and clear our mind and think about other things. Think about the big picture. Think about what it's going to feel like to be a licensed massage therapist. Maybe explore the jobs that are available. But we take a break from the studying to come back refreshed, to come back hungry. Yeah. And that works for me too, and for Tara. Tara and I were saying this week, we're like, oh my goodness, we're going to take a day off. How's that going to feel? I was going to say, oh, it's going to feel kind of weird, you know? But it's good. It's a healthy part of your studying experience. So today we are studying medical terminology. You ready? Let's do it. Healthcare terminology, also called medical terminology. Why do we care? We're not working in a hospital. Well, maybe you will be. But why we care about healthcare terminology is because this gives us more descriptive words to communicate, sometimes with clients, sometimes with colleagues, people you work with, and sometimes with doctors and nurses. It gives you another layer of language to understand a condition. And you're going to understand a bunch of different conditions after we go through today. And additionally, there's a better understanding of the conditions with, like, if your client brings you a lab report, if you're looking at someone else's soap notes, maybe you work with a group of therapists and different people do soap notes. Better understanding of those soap notes. Also, when you've got some words, you feel a little bit more confident, a little bit more professional, right? And it helps to have discussions that I call interdisciplinary, which means that people who practice different disciplines, whether it's physical therapy or yoga or nursing or, just all these different disciplines that people do to stay healthy. It really fosters interdisciplinary discussions when you go to conferences, when you take continuing education. Yeah, it gives you that foundation of knowledge. So, and also, it's going to be on the MBLEx. So we got to study it. Here we go. And according to ELAP, uh, our school curriculum, one of the things in ELAP that it says we need to do is that a licensed massage therapist will demonstrate knowledge of key terms and concepts related to healthcare terminology, including the ability to break down unknown words into word elements, use a medical dictionary, understand positional and directional terms, body planes, movements, body regions, cavities, abdominal quadrants, and on an exam. So what we're focused on today is the healthcare terminology and breaking down unknown words into word elements. And we cover that other stuff, terms, body planes, movements in navigating the body. So feel free to look that up in your online learning center. We are going to start with a medical terminology cheat sheet. And I wanted to just give a shout out. The cheat sheet concept started with Rasmussen College. They had a medical terminology cheat sheet. And I was like, oh, we need one of those. So, along with the lesson today, and thank you to Carrie, I believe it was Carrie who requested a worksheet. So, with our lesson today, you will have a worksheet, an attachment of a worksheet with all these terms. So, yes, you can take notes. Yes, there's going to be a recording of this video. However, there's also going to be the worksheets that will include each of the completed pages that you'll see in class today. So, yay! All right. Before we talk about big, long words, I wanted to practice with some short words, with some little words. So pulling apart words, and we've talked about this in the past, but I wanted to start with some easy words to explain the root word, the prefix, and the suffix. Because when you get like a 12-letter word, come on now, really? So let's start with some easier words. And in each of these words that you see on this chart, there's a root word, which is the root, like it's the root of the tree. It is the main meaning of the word. Now and then you add a prefix or a suffix, and it changes the meaning of the word. Take a peek. So on this chart, the root word is circled, lock. And then when you add you unlock it. Well, you're going to lock the door, and then you're going to put a prefix, like pre-race, Pre-op, pre, it comes before, right? So we're going to put a word before or letters before the root word that sometimes can change the meaning. Now, normally in healthcare, it adds to the meaning. Our terminology is going to add to the meaning, or it's going to more fully describe the meaning of that root word. But let's look. Unlock. Un is the prefix, lock is the root word. Distrust, remix, rewrite. I think you get the idea. The circled word is the root, and the prefix comes before it. In fact, I think I circled the prefix here. Yep. So the prefix is that first part, pre. Yep. I keep thinking premature. Premature delivery means the baby came a little early, right? So came early, came before. So these letters come before. And we'll talk about suffix in a minute, words that letters that come after the root of the word. Oh, I guess we'll talk about it right now. I did add this slide. I love this one. Uh, so this is in English. This is not necessarily medical terminology, but it's demonstrations of words that have suffixes. So, and it gives you the definition of the suffix, but you don't have to memorize the definition of the suffix. I guess you could if you want to, but it doesn't always make sense. So, um, so clockwise in relation to, usually directional. So clockwise. So we know the clock, and then it's in relation to what direction it's going clockwise. Weather-wise. What's happening weather-wise in relation to? All right. And ness is something we see now and then. It's the state of being. So sickness, it is a state of being. Heaviness, a couch is in the state of heaviness. It's a heavy couch. Happiness, in the state of happiness. And then the OUS or IOUS is a characteristic. But these are just examples of suffixes. So religious, ridiculous, here's a few more. Hopeless, thankful. These are all examples of letters that come at the end of the word, called a suffix, that enhance what that word is saying. And thank you to 7ESL for my charts here. All right, let's start with the medical side of things. Here's a suffix, ology. Ology simply means the study of. It's logy, technically. But for example, biology, the study of bio, the study of life, living things, the study of bodies that are alive. Biology, bio, logy, bio, life. Bio means life. Biology, the study of bodies that are alive. Astrology, the study of the astros, the stars. The studies of the stars and planets is astrology. And before we started recording, I mentioned today happens to be the spring equinox. And in astrology terms, it's actually New Year's Day. Today is the first day of Aries, the sign, the astrological sign Aries. If someone is born today, they're born under the star, the sign of Aries. Do you know what sign you are? Yeah, do you know your sun sign? So it's just an interesting time because we have this spring equinox that is hopeful. And then we also have this energy of a new year. So Pisces is at the end of the astro year, and Aries is at the start of the astro year. So Happy New Year. Happy astrological New Year. All right, here's a word. Okay, now some of you may have seen this word before if you've been to a certain type of practice. Holy mackerel. How many letters is this? 4, 8, 12, 16, 17, 18, 19-letter word. Oh my goodness. Do you have any idea what this means? Ah, just wait. You'll be able to figure it out. Well, we just had a little exercise where we said ology is actually the study of, right? The study of. And so we know this is the study of something. Can you find any words in there that you recognize? Ah, wait a minute. What about that word? What is a rhino? If you've been to the zoo, you may have seen a rhino. I'm talking about a rhinoceros. You might have seen one on PBS if you're watching a special. Rhino. Okay. That's a word you can recognize. It means something. What does rhino mean? If you have seen a rhinoceros, let's do this. Oh, nope, I guess not. Yeah, there we go. So if you've seen a rhinoceros, what is characterized by a rhinoceros? Look, that big old horn, right? Rhino actually means nose. Ooh, okay. So is this the study of noses? Got a few more words, right? Let's take a look. So let's break down the word. Auto, rhino, laryngology. Auto means something to do with the ear. O-T-O, something to do with the ear. Now you may be thinking audio, right? As far as the ear. Audio is hearing. This is the actual ear. It includes hearing for this particular profession. Then we've got the rhino. Look at that. Related to the nose. Rhino with that horn. Okay. And then larynx. It's actually related to the larynx. Huh. Ear, nose, larynx. The study of ear, nose, larynx. So with the prefix ear, root word, nose, and larynx, it's the study of the ear, nose, and throat. So you may have never seen that word before, but have you heard of an ENT doctor? Well, now you know. An ENT doctor is an ear, nose, and throat doctor. Want to try a few more dissecting the words, pulling apart the words? Let's give it a shot. Hemopathology. Okay, let's break them apart. And we just said logy is the study of something. All right, so that's the study of something. Ooh, you might recognize that word, that full word. You see pathology in there? All right. Hemopathology. Prefix is hemo. That has to do with blood. Like hemophiliac, hemoglobin. Yeah. And pathology. What's pathology? Hmm? What actually is pathology? What's the definition of pathology? Hmm? Yes. So it is the study of diseases. Yes. And so hemopathology is the study, or it's the study of disease or dysfunction. So this is the study of diseases of the blood. Did you see how you figured that out? Yeah. All right. Let's see a quick comment. Yeah. Good. That's right, Maya. All right. Ready for another one? All right. Let's do it. Neuropathology. All right. Let's do this again. You got a prefix, you got a root word. You can figure this out. So the study of, right here, logy, the study of pathology. We just talked about pathology, right? Neuro. Neuro. Where are we in the body if we're talking neuro? Hmm? Mm-hmm. Mm-hmm. Let's see. Oh, I like a little chitty chat. Good. Yep. Good. Ms. V, nerves, yes. Lec, yes. NE. Yep, we need a little bit more than that. So neuro, right? Neuro is the prefix here. So we're talking about the nerves or the brain, right? A neurologist studies the brain, studies pain in the nerves originating in the brain. Pathology, dysfunction or diseases. So neuropathology is the study of diseases of the brain. Now, does not say neurologist, because that's a doctor. An ologist is a doctor who studies diseases of well, actually studies the brain. Yeah, usually pain specialist. All right, another one. Okay, well, we're a little bit off the beaten path here. So the biopsychosocial, not a word you see very often. I happen to write a book about it, the biopsychosocial method, called The Body Blueprint, How Your Pain May Be Telling a Story. But let's break it down. Bio, psycho, social. Bio, biology. Psycho, psychology. Social. You see all those three parts there? Good. So what does it mean? It is used to describe the biopsychosocial method. So the biopsychosocial method is actually used by massage therapists. It looks at pain as it's originating from the body, the bio, mental stress, the psychology, or social pressures that are going around, that are going in a client's life. So massage therapists understand that it's not just the body that creates pain. And in Western medicine, we focus a lot on the body, on the physical. And yet sometimes it's mental pressure, mental stress. We all recognize mental stress causes a headache or a physical symptom, right? That's an example of something mental, something we can't see. We can't cut out mental stress. Although there's lots of pharmaceuticals that try and treat it. Social pressures, what does that look like? Social pressures can be losing a job, moving from their home, separating from their partner. Social situations that's causing some pressure. These can all be the source of pain, and it's a term that was coined in 1977 by Dr. George Engel, asking his colleagues, his doctor colleagues, to look at their patients using the biopsychosocial method. to dig below the surface of their biology to see what else was going on with them. Yeah. All right. Good. Good. Breaking apart the words. Yay. All right. Oh, let's try one more. What is cellulitis? Hmm. What is cellulitis? May have heard of it. Well, let's use our method, right? What's the suffix here? Good, yes. Excellent. So the suffix is itis. Itis means inflammation. But inflammation of what? Mm, inflammation of the cell. Yes. Cellulitis is an inflammation of cells. It happens, this is a classic look at cellulitis. Um, and I mention it because it's a condition you may not be familiar with 100%. So let me tell you exactly what it is. Cellulitis is a bacterial skin infection, which means something from the outside, a bacteria from the outside got into some layers of the skin. So skin and the underlying tissues. Um, and that bacteria, the body is fighting that bacteria. It's typically some type of stress bacteria, streptococcus, but it enters through a break in the skin or a wound. And cellulitis is a contraindication for massage. Let me just make sure you can see this. Good. Active cellulitis is a contraindication for massage. So for the purposes of the MBLEx, cellulitis is a general contraindication. Why? Why don't we just avoid that leg? Let me tell you. Active cellulitis, meaning they're on some type of antibiotic for bacteria, right? Uh, so if it's active, then massage can potentially spread the inflammation, which would, of course, increase our client's discomfort. So obviously, massage stimulates circulation, which is one of the benefits of massage. We stimulate circulation, but that can spread infection. Yeah, yeah. Not all the time, but sometimes. So, of course, it would be also increased discomfort if you were to massage near the area. There'd be pain, can interfere with the body's ability to heal. Um, and I wanted to take this moment just to also talk about local versus general contraindications. And even though cellulitis is localized, um, like in the leg, like kind of an abscess or a blister or something like that, we wouldn't work directly on it. It is still a general contraindication because it has the ability to move through the bottom. It's systemic, like the flu, like a fever, that's systemic. So, um, other systemic conditions are um, or general contraindications, excuse me, other general contraindications, meaning you cannot do the massage, is blood clots, deep vein thrombosis, uh, thrombophlebitis, DVT, and fever. So just a reminder that although we always look for reasons to do the massage, there are contraindications that are general contraindications that could make the client worse. All right. A little pathology for you there. All right, more healthcare terminology. We have more and more. All right, let's look system by system at the root words. Cardio. Yay. Did you do your cardio today? So cardio refers to the heart, cardiology, the study of the heart. Angio. Uh, angio has to do with a blood vessel. As we looked at pathologies of the cardiovascular system, we learned that blood vessels are arteries, veins, and capillaries. And so angio is of the blood vessel. So an angiogram is an X-ray of the blood vessel. So sometimes you'll hear people go, oh, I have to go in for an angiogram. They're going to take a look if there's any blockages in the heart, usually. Arterio or arteriosclerosis. Sclerosis is a hardening. So a hardening of the arteries. Arterio is arteries. It looks like artery. Look. Yep. Phlebitis. Phleb is a vein. So itis, inflammation of the vein. Hemo, we talked about this a little earlier. Hemophiliac, hematology, ology, the study of the blood. Hemopathology, the study of diseases of the blood. All right, respiratory. Reminder, pulmonary relates to the lungs. Pulmono, so pulmonary, CPR. Cardiopulmonary, resuscitation. So cardio, heart, pulmonary, lungs. Bronchio. So bronchitis. Where does bronchitis happen? It happens in the bronchioles or the bronchi. So pneumo is the air or lungs, pneumonia. It's funny that that's not, pneumonia is actually an infection of the lung tissue, which does indicate inflammation, but I haven't heard the term pneumonitis. I think it's just pneumonia. Yeah. All right. A laryngo, that was ears, nose, throat, right? The larynx, our throat. A laryngoscopy is an examination, a scope of the larynx. So they're going to usually take a little camera and put it down the larynx to see what's going on with the throat. The trachea, okay, so the larynx is our throat. There is a part of our throat that turns into the esophagus that goes to the stomach. The trachea is our windpipe. So a tracheostomy, yes, tracheostomy or tracheotomy is a surgical opening. They make a little hole right here, tracheotomy or tracheostomy, make a little hole right here in the windpipe in case the throat is blocked. Something's blocking the throat. Need to get air to those lungs. Digestive. All right, gastro. Gastritis, Gastritis is an inflammation of the stomach. A gastroenterologist is a doctor who studies the stomach. Entero. A gastroenterologist actually combines those two, gastro and enter. And so diseases of the intestines. So the large intestine, the small intestine, the ascending, descending, sigmoid colon. So the intestines and the colon are actually the same thing. In massage school, you may have learned ascending colon, transverse colon, descending colon, sigmoid, when you were learning the colon stroke. That has to do with the small intestines and the large intestines. Okay. Hepatitis, hepatologist, hep has to do with the liver. Hepatitis is inflammation of the liver. I don't know how to say that, but it's a gallbladder. Cholecyst. Oh, a cholecystectomy is a removal of the gallbladder. Okay. So a cholecystectomy. All right. Some of these words I don't use very often. I say they had their gallbladder removed. All right, pancreas. You can see this here. Look at the pancreas. Pancreatitis, again, inflammation of the pancreas. On to root words of the urinary system. Nephro had to do with kidneys. Nephrology, the studies of the kidneys, or study of nephropathology or nephro. It's the study of the kidneys, but normally when the kidneys aren't functioning. Like we know how the kidneys are supposed to function. And so nephrology is usually the study of kidney dysfunction or disease. Renal also has to do with the kidneys. Renal, relating to the kidneys. Okay, so nephrology is the study of kidney disease. If you're having tests on your renal system, it's testing your kidneys. Good. Cysto again, the bladder, the urinary bladder. A cystectomy is an examination of the bladder. And then urethra has to do with the urethra, which is the coming from the bladder. That's that tube that's go down the ureter and the urethra. Yeah. So in this case, urethritis is an inflammation of the urethra. And just FYI, the ureter is where kidney stones often get stuck. So kidney stones has to do with the urinary system. They leave the bladder, usually the bladder, and go down through that tube. And as it gets skinnier, if that kidney stone is too fat, it might get stuck. And that's where the pain is coming from, is the kidney stone stuck in the ureter. Just so you know. Nervous system, nerves, neurology, the study of the nervous system. Some would say brain surgeon. Like if you're a neurologist, they say, oh, you're a brain surgeon. Yeah, maybe. But we're looking at pain in the nervous system. And so sometimes the problem is in the brain. Sometimes it's in the peripheral nervous system. If there's a compression in the brachial plexus, that's the peripheral nervous system. So it's still a neurological problem because it has to do with the nerves. Encepha, you might have heard of encephalitis. That is inflammation of the brain, encephalitis. Meninges, the meninges, that's the membranes, that's the sheath, the membrane sheath that covers the brain and the spinal cord to protect it. And meningitis is an inflammation of the meninges, which is that sheath, that membrane covering of the brain and the spinal column. It's very dangerous when someone has meningitis. There's not a lot of room for inflammation in the cranium. Sometimes they even have to drill a hole in the skull to relieve some of the pressure. Yeah, they can do so without harming the patient, but it's a very serious condition, meningitis. And then myelopathy is a pathy, again, a disease of the spinal cord, something happening in that. Myelo. Musculoskeletal. So I was just looking at this because this myelo is the spinal cord, but we have myo, which is muscle. All right. Osteo. So we're talking about musculoskeletal now. So bones and muscles. We've got osteo for bone. We've got artho for joint. Arthritis, inflammation of the joints. Osteoporosis, a loss of bone density. Myo, muscle. Chondro, cartilage. Chondromalacia, a softening of the cartilage. This is fun. We get to go through all these words, like pull them apart, but we're also learning all about these different pathologies that have these words in them. Yeah, kind of 2 for 1. Integumentary, our skin. So dermo, and cutane. So dermatology is the study of the skin, and cutane is cutaneous, Cutaneous is what's beneath the skin. So sometimes we talk about subcutaneous fat, sub skin. Reproductive system. So gynecology, the study of female reproductive system. Androgynous, androgen, the male hormone. Uh, oophore, the ovaries. I have never called uh, the removal of the ovaries an oophorectomy, but look at here, ectomy, ectomy. It means taking out, right? Good. Okay. Orchi, again, a new one for me. The testicle, orchitis, inflammation of the testicle. All right, so root words of our five senses. Ophthalmology, ophtho, eye. Ophthalmologist, optometrist. Yeah. So ophthalmology, the study of, right? Ology, the study of. Optometrist, excuse me, let's go with ophthalmologist, is an eye doctor. Different degrees of eye doctor. You have optometrist and ophthalmologist. Optometrist is usually dealing with your sight. An ophthalmologist deals with problems of the eyeball. I know, so many little distinctions, right? We saw earlier otitis is inflammation of the ear. Rhino, our nose. A rhinoplasty. So maybe you know someone who's had a rhinoplasty, and that's surgical. And sometimes for a deviated septum, they'll have a rhinoplasty to surgically alter their nose. And then gloss actually has to do with the tongue. You probably won't see that ever, but glossitis is inflammation of the tongue. Okay, and another brief review of key root words. Patho, disease, pathology, the study of diseases. Onco technically means tumor. Oncology, the study of tumors. We think usually when we hear oncology of cancer. Cyto is cell, cytology, the study of cells. Histo, tissue, histology, the study of tissue. We think of histology a lot with the study of the tissue of the sinuses. All right. We are going to take those root words that we just looked at, and we're going to see what you remember. All right. Ready? We're starting with dermatome. And you don't have to put anything in the chat right now. We're just going to walk through it. It's skin, gastro. What you got? Stomach, nose, rhino, but nasal passages, right? Also need to know. Opto, ophthalmologist, we talked about. Pneumo has to do with air in the lungs. Myo, one of your favorites. Muscle. Cardio, touch it. Good, heart. Artho, joints. Osteo, bone. Nephro. Do you remember nephro? Nephrologist. Nephrology. Kidneys. Yeah. Mammo has to do with breasts. Mammogram, right? Testo. Testosterone is produced in the testes. Now, what about this? Gluco, glyco or glyco. Sugar. That's sugar in the blood. glycogen, glucose, sugar in the blood. And then neuro, nerves, brain. Yes. Good. Came a little easier this time, right? Now I will tell you, if these are new to you, you will need to know them. The MBLEx will throw you a few of these, I am sure. Yeah, you will see these terms on the left at the start of words. So yeah, it'd be very good to familiarize yourself with these common root words. All right. I wanted to do the same thing with our prefixes, but I found this to be very clunky to try and ask you for an example of a word that uses like a or an, lack without, analgesic without pain, um, bad, painful, difficult. It's dysfunction. So what I decided to do was just give you all the words, give you all the examples. So dysrhythmia is an abnormal rhythm, right? If there's dysrhythmia of the heart. Hyper, up, right? Hypertension, above, excessive, beyond. High blood pressure, hypertension. Hypo, beneath, below. Hypoglycemia, low blood sugar. Macro, big. Macroeconomics doesn't have to do with body work, but it gives you macro and micro. Macro, big. The part of economics concerned with large scales, big economic factors as far as like the interest rate in the US or uh, how much production, how much national productivity. They call it GNP, gross national productivity or product. How much is the US producing? That's macro, big. We look at all the US. Whereas micro, microscope, right? Microorganism, tiny, small. I use microeconomics, but if that's the study of like individuals and businesses, like a little bit more like or small towns or cities, it's more microeconomics and how decisions made by individuals and businesses affect supply and demand. Thank God we're not studying economics, right? All right, post, after or behind, post-operative, after a surgical operation. Prefix, pro, in front of, before, preceding. So pre-op, prior to the surgical operation. Retro, if retroactive, I dressed in a retro outfit, from behind, from the past, from kind of backward. Retrocardiac, well, that would be behind the heart. That's a rough one. But retroactive. So it's already gone by, but we're going to make it retroactive, coming from behind. And then since we did prefixes, let's do suffixes. So abdominal, AL. Celiac, related to. So in this case, we're going to use celiac relating to the abdomen, abdominal. We're looking at the suffixes here. Ac, AL. These are a little bit more difficult. All right. ISIT, dentist. So the person, so a doctor, a dentist, a person or an agent, the dentist, a person who works on teeth and gums. Ism, and these are just terms you might see. Dysmorphism, a condition of an anatomical malformation. Ism, it is a condition. Hypothyroidism, um, hyperthyroidism. Mm, yeah, so ism, they sometimes tack that on the end of a word to make it a condition. to make it a new condition. And be careful about labeling your clients. They may have a condition, but that does not define them. Yeah. Ectomy, the removal of the tonsillectomy, the surgical removal of the tonsils, right? Ectomy. Plasty, we talked about the surgical repair. So a rhinoplasty, there's a surgical repair of the nose. Rhino and plasty. Itis, inflammation, pancreatitis, inflammation of the pancreas. Ologist, one who studies, a specialist, so a cardiologist. Yeah, cardiologist is the one who studies the heart. Biologist studies biology. And ology, the study of, remember from before? Yeah. So oncology, the study of tumors. Oma, tumor. Melanoma, skin. So skin cancer is called melanoma. Melanin is in the skin, and a tumor of the melanin-forming cells. So a tumor of the skin, melanoma. Skin cancer, a skin tumor. Pathy, disease. Angiopathy, pathology. Pathogy, disease. Pathology, the study of disease. Disease related to blood vessels. Angio, blood vessels. Pathy. And scopy. So a scope, they usually call this a scope, or endoscopy. So endoscopy is a visual examination of within the body. So endo, so it's going in, the process of visual examination. They're going to use a scope. All right, I think that, yeah. I was going to say, I think that's the end of our medical terminology. Woo, woo. Time to dissect some questions. There is a lot of words running around your head right now. Be careful. Be very careful. We have, I think, almost 10 questions to go through. I think it's 9 or 10 questions today. I'm up in the ante on the questions because y'all love dissecting questions. However, I will tell you, I have made some of these questions medieval, meaning very difficult, challenging. The answers are tricky. Be careful. So as we go into the questions, let me remind you to please hold off on sending your answers. Yes, so I'm going to read through the question. I'm going to read through the answers. The reason we do this is because we have all kinds of learners out there, all kind of graduates. We have some visual impaired graduates. We have some English as a second language graduates, and everybody reads at a different speed. This is to your advantage, you speed readers. Those of you who finish the practice exams in under an hour, really need to take those practice exams in about an hour and a half. When you go too fast, it's very easy to make mistakes. So, how we do our questions is I read through the question, I read through the answers, and then I say 3, 2, 1, go. And that's when you put your answers in the chat. That way we all have a chance to read the question and to process the answers. Faster doesn't mean better. In fact, faster sometimes mean more likely to make a mistake. So be careful. All right, you've been warned. What are the key parts of understanding healthcare terminology? Excuse me, let me read that again. What are the key parts of understanding healthcare terminology? A, root, prefix, suffix. B, sounding it out. C, pronouncing the word correctly to other healthcare professionals. D, the beginning, middle, and end of the word. What are the key parts of understanding healthcare terminology? Mm-hmm. Mm-hmm. Is it the root, prefix, and suffix, sounding it out, pronouncing the word correctly to other healthcare professionals, beginning, middle, and end of the word? Okay. 3, 2, 1, go. Okay, let's take a look here. Very nice, Julia. Good. Diane, yes. Dantasia, got it. Lance, good. Lek, yep. Good, Ms. V. Patithia, yes. Shasta, yeah. Rachel, you got it. Dorea, Carrie, good. Brenda, nice. Patricia, nice. Good, 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 good. All right. Let's get rid of one wrong answer. Sounding it out doesn't matter. And best answer, boom. What we've been talking about. The root, the prefix, and the suffix. Given that your word is a medical, is a medical term, because we've got healthcare terminology and medical terminology. They sometimes get called the same thing. But given that your terminology it's long and it has those things, that's the best way to figure it out. Next question. What does a urologist study? What does a urologist study? A doctor who specializes in diagnosing and treating in females, specifically the urinary tract and female reproductive systems. B, the branch of medicine and physiology concerned with the function and disorders of the urinary system. Letter C, the doctor who specializes in diagnosing and treating diseases of the urinary tract and male reproductive system, including conditions like kidney stones, prostate problems, and urinary incontinence. And D, the branch of medicine and physiology concerned with the function and disorders of the uterus. What does urologist study? What does a urologist study? A doctor who specializes in diagnosing and treating diseases in females, specifically the urinary tract and female reproductive system. Is it the branch of medicine, letter B, the branch of medicine and physiology concerned with the function and disorders of the urinary system? C, is it a doctor who specializes in diagnosing and treating diseases of the urinary tract and the male reproductive system, including conditions like kidney stones, prostate problems, urinary incontinence? D, the branch of medicine and physiology concerned with the function and disorders of the uterus. Urologist. Well, let's go 3, 2, 1, go. We'll eliminate one wrong answer in a minute. I know, I know. All right. Here we go. Patitia, yes. Julia, yes. Paris, yes. Patricia, yes. Brenda, yes. Let's eliminate one wrong answer. No one was fooled by letter A. There's a doctor who specializes in the diseases, in diagnosing diseases of the reproductive system, urinary tract, gynecologist. Best answer, Boom. Letter C. Letter C. You're like, what? What are you talking about? Look at the question. What does a urologist study? It's a doctor who specializes in diagnosing and treating diseases of disorders, urinary tract. The branch of medicine, urology. And I can see, you know what? I can see how letter B might have been close enough, right? Because it doesn't say who is a urologist. It says, what does a urologist study? Letter C was the best answer, but I'll give you a letter B because at least you didn't go with the uterus. Yes. So those nuances, be very, very careful. Just be very, very careful. All right. Next question. All right. So Rachel, I agree with you. Rachel says, I disagree. So because the urologist does not study a doctor, right? What I'm trying to make the distinction between is that a urologist is IST and the branch of medicine is urology. And so a urologist does study that branch of medicine. So I'll give you both. Yeah.
I
I'll
got a
reword
different
that
take.
question next time. Say again.
I got a different take on it.
Go ahead, Ms. V.
The fact that it says male reproduction system is what made me not pick that because it's any reproductive system.
So a urologist, that doctor, study is specifically for males. And women don't have prostate problems, but a urologist is specifically for men. The gynecologist specifically for women. And that is important to note, right? So if your client has any one of those conditions, as far as your male client has a urinary tract issue, reproductive system, erectile dysfunction, kidney stones, prostate problems, having to get up and pee all the time, your male clients go to a urologist.
Anybody goes to a urologist, male and female go to the urologist.
When it's So when a woman has, it depends on the issue, right? Urologists are known for treating men. So women typically, when they have a urinary problem, urinary incontinence, urinary tract infection, they go to the gynecologist, who may refer them out if there's, a problem of the bladder. I'm stretching now. I'm stretching beyond my area of expertise. So
Right.
the
I
distinction,
worked for a neurologist, male and female rolled in the door.
so urologist, right? Ms. V, did you work for a urologist?
Yes,
Okay,
and
very
male
good.
and female came in, not
Beautiful.
just males. Everybody came in that had a urinary problem.
Okay. And would you say that the ratios were about even?
I'd say so. I didn't see a distinction between who was rolling in the door to, because if I'd have had that knowledge that, oh, it's more uh, males, I would have not picked that answer.
Yeah, no, understand it. Good. So this is
Jody, from
you,
my understanding, it's male and females go to urologists for urinary issues. Males go for reproductive issues as well.
oh, okay. So it's the reproductive side of things.
Yes.
Thank you. Okay. Very good. Well, hey, this is why we come here to learn, right? So we're clear that females go to the gynecologist, but for urinary issues, As Tara and Miss V have pointed out, both. So definitely C's the wrong answer. Very good. Good. All right. Well, I stretched beyond, tried to make it a little interesting and stretched beyond my knowledge base. So thanks for sharing your experience of the urologist. So specifically male reproductive, prostate problems, those would need to be, that would go to the urologist. The men would be going to the urologist. But good to know that women use them too. Next question. Does healthcare terminology always have a suffix? Does healthcare terminology always have a suffix? Very simply, yes, no, or all past tense terms have a suffix. I like the drama of waiting to get rid of one wrong answer. So does healthcare terminology always have a suffix? A, yes, B, no, and C, all past tense terms have a suffix. 3, 2, 1, go. All right, let's see. Ms. V, correct. Lance, yes. Julia, yes. Diane, yes. Carrie, got it. Brenda, yes. Shasta, yes. Paris, yes. Ooh, these are harder questions today. Let's get rid of one wrong answer. All past tense terms have a suffix. That has nothing to do with healthcare terminology. Best answer? Boom. No. The reason being is the term healthcare terminology is not just about medical terminology. Here's examples of some of the healthcare terminology on the right here. Put this over here. So healthcare sometimes has a prefix, sometimes has a suffix, but healthcare terminology can be words like this. And that's why I'm giving you worksheets after our session today, because there's a lot of healthcare terminology that is a part of other classes that we do. Like we talked about the axillary region. We talk about that in our navigating the body and when we talk about regions and regions of the body. Brachial, we talk about during our respiratory lesson. Calcaneal, that has to do with our anatomy lesson. So these are still healthcare terminology. Today we focused in a little bit more on medical terminology. All right. Ready for the next question? Ooh. Your client tells you that they have the condition thrombophlebitis. What does that tell you? Your client tells you they have the condition thrombophlebitis. It's on their health intake sheet. What does that tell you? Okay. A common bacterial skin infection that affects the deeper layers of the skin and underlying tissue. It's caused by a bacteria, typically staph or strep, entering the skin through a break or a wound. Letter B. That tells you they've had recent surgery to correct a disc problem in the thoracic region of the spine. There is normal inflammation after surgery, and you will avoid the area. C. Vein inflammation that happens in connection with one or more blood clots. This usually happens in your legs, but can affect any vein. D. Recent surgery to remove varicose veins that has now developed some inflammation. Your client tells you they have the condition thrombophlebitis. What does that tell you? Now, in this one, we are going to eliminate a wrong answer. We're going to eliminate letter B because this is not about the thoracic region of your spine, of their spine, right? Your client tells you they have thrombophlebitis. What does that tell you? A common bacterial skin infection that affects the deeper layers of the skin and underlying tissue caused by a bacteria, typically staph or strep, entering the skin through a break or wound. C, vein inflammation that happens in connection with one or more blood clots. Usually happens in the legs, but can affect any vein. D, recent surgery to remove varicose veins that has now developed some inflammation. 3, 2, 1, go. All right, let's see. Rachel, nice. Lek, good. Julia, Patithia, Ms. V, Lance, Lily, got it. Patricia, Carrie, Diane, Paris, very nice. Very nice. Best answer. Boom. Vein inflammation that has happened in connection with one or more blood clots. Usually happens in the legs, but can affect any vein. So itis, that is inflammation. So it has to be C or D, not infection, right? Phlebitis, blood, thrombo, clots. Clots in the blood. This is also the name given to DVT, deep vein thrombosis. That means clots. Thrombosis is clots. So, deep vein thrombosis, clots, usually in the leg, that they're keeping an eye on or have given the client blood thinners. Yes. Good. Ready? On the intake sheet, your client indicates they had an appendectomy. They have fully recovered over the last 8 weeks. What procedure did they have? On the intake sheet, your client indicates they've had an appendectomy. They've fully recovered over the last 8 weeks. What procedure did they have? A, surgery on the appendix. B, surgery on the appendicular skeleton, normally a broken bone. In the leg. C, removal of a skin appendage. D, removal of the appendix. On the intake sheet, your client indicates they've had an appendectomy. They fully recovered over the last 8 weeks. What procedure did they have? 3, 2, 1, go. Very good. I see all these answers coming in. All right. Ready to eliminate one wrong answer? They did not have the removal of a skin appendage. Let's take a look. Let's take a look. Good, Lisa. Good. All right. And Rachel, yes. Lily, yes. Ooh, you guys were good. Lance got it. Lisa, yes. Shasta, good. Diane, good. Julia, yes. Dora, Paris. Lek and Carrie, you got it. Brenda and Patricia, yes. Jerea, yes. Very good. Best answer? Removal of the appendix. Yes. So appendectomy, ectomy, removal. Yes, removal of the appendix. Surgery on the appendix. Yes, that's true. They had surgery on their appendix. But the best answer is the removal of the appendix. All right. Ooh. The prefix hypo means what? A, homeostasis. B, sugar. C, high or fast. D, low or slow. The prefix hypo means what? Homeostasis. B, sugar. C, high or fast. D, low or slow. 3, 2, 1, go. Oh, you guys know this one. Gonna wait till we get all the answers in the chat. All right, ready to eliminate one wrong answer? It is not homeostasis. Ms. Rachel, yes. Julia and Patricia, yep. Good. Paris, got it. No, sorry. Petithia, there we go. Petithia, you got it. Lisa, yep. Lance, Ms. V and Shasta, uh-huh. Dora and Diane, yes. Lily and Lek, yes. Brenda and Carrie, okay, good. Nice. Very good. Best answer, boom. Low or slow? Hypo, hypo. Hyper, right? Hypo, hypo. Low and slow. All right, good. Next question. What is the condition hyperglycemia? What is the condition hyperglycemia? A, too many gyros in the system. B, too much glucose in the system. C, too little glucose in the system. D, both high and low blood glucose. What is the condition of hyperglycemia? A, too many gyros in the system. B, too much glucose in the system. C, too little glucose in the system. D, both high and low blood glucose. Ready? 3, 2, 1, go. Lance and Rachel, yes. Diane and Dorea, yes. Dora and Julia, good. Good. Carrie and Shasta, yep. Patithia and Lek, yep. Lisa and Ms. V, nailed it. Brenda and Paris, uh-huh. Good. Patricia, yes. Best answer, boom. Ooh, got rid of one wrong answer, forgot about that step. It's not too many gyros. Boom. Letter B, too much glucose in the system, right? Too much glucose in the system. Hyperglycemia. Too much glucose in the system. Too much sugar in the blood. All right. Ready? What kind of doctor is a nephrologist? Ooh, nephrologist. Ooh, do you remember this? Okay. What kind of doctor is a nephrologist? A, nose. B, kidney. C, heart. What kind of doctor is a nephrologist? A, nose. B, kidney. C, heart. 3, 2, 1, go. Go, 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 go. Mm-hmm, mm-hmm. Mm-hmm, mm-hmm. Answers keep coming in. I'm going to go ahead and eliminate a wrong answer because we know it's not the heart doctor. Let's see what we got. Okay, gotta see where we started here. Here we are. All right, Carrie and Patithia, yes. Alec, yes. Rachel and Diane, yes. Lance, Lisa, yes. Julia, yes. Durea, yes. Patricia, good. Lily, sorry, Lily. Good. Paris and Brenda nailed it. Ms. V, got it. Good. Best answer, letter B. It's a kidney doctor. Now, this question is interesting because earlier in our lesson, we talked about the rhinoplasty, right? And that the doctor who takes care of the nose is either nasal or rhino. Yeah. So even if you didn't know nephrologist, you might know rhino and you probably know cardio. So process of elimination can also get you to the best answer. All right. Let's go. What would be the best definition of a gastroenterologist? Ooh. What would be the best definition of a gastroenterologist? A. Digestive problems such as irritable bowel or Crohn's disease. B. A doctor who is also called an internist. They are trained in diagnosis and treatment of the internal organs. C. The condition of heartburn, acid reflux, and celiac disease. D. A doctor who specializes in treating digestive issues. What would be the best definition of a gastroenterologist? A. Digestive problems, such as irritable bowel and Crohn's. B. A doctor who's also called an internist. They're trained in diagnosis and treatment of the internal organs. C. The condition of heartburn, acid reflux, and celiac disease. D. A doctor who specializes in treating digestive issues. 3, 2, 1, go. Go, gotta go, go, go. Go, speed racer, go. Let's get rid of one wrong answer as the answers are coming in. We know that it's not going to be the condition of heartburn, acid reflux, and celiac. Best definition of a gastroenterologist. Let's take a look at the chat. Rachel, yes. Lisa, yes. Julia, Lily, yes. Lance and Dantasia, yes. Shasta and Diane, you got it. Lek, Patricia, yes. Durea, Patithia, Brenda, Paris. Oh, Ms. V, It's tricky, it's tricky. Yep. And Ms. V, you nailed it. You nailed it. Boom, take a look. Best answer? Boom. Letter D. The gastroenterologist, gastro, stomach, digestive issues, the colon, and the colon also. So the ologist is the doctor who specializes in treating those digestive issues. Excellent, excellent distinctions, you guys. Because what does a gastroenterologist treat? He treats the condition of digestive problems, IBS and Crohn's. Yes. All right. We're done. Woo, marathon questions. So the reason we study healthcare terminology is because it gives us a certain level of professionalism. It gives us a certain level of confidence. And look, you saw me crash through urology and urologist today. We don't always get it right. And so being willing to investigate, being willing to get more details. In fact, I'll tell you the truth. I'll tell you a story. It's very embarrassing. Yeah. Um, I had a client who came in, filled out his health intake form, and put on his form that he had ED. And I was reviewing his form and said to him, so what's ED? And he said, oh, erectile dysfunction. And I was like, oh, okay. All right. Looks like no recent surgeries. Great. I just moved right along. I'm not going to address um, all the benefits of massage, but we do not massage uh, genitals. So could improved circulation help all circulation? Why, certainly. But I stumbled right into that one. I was like, oh, what's that? I'm not familiar with that. Ah, good point. Yeah, good point. So, um, so naked dentist says, so was that necessary information necessary? You know what? My health intake sheet is very thorough. And if my clients are on medication for a condition that might impact their session, then yeah, I would want to know about the condition or the medication. He was not trying to be cheeky. In English, we say cheeky, right? Um, so is that important for clients to put on the health intake? We cover all systems of the body on the health intake sheet. Yeah, yeah. So, so this wasn't the client trying to be sexualize the massage at all. Um, at least I shut it down. If he was, I wasn't going to play that game because my treatment room is a therapeutic setting. But the point is that there are times we crash through a condition and just be like, hey, I don't know what that is. Could you help me understand that a bit more? And that would have been a better question to, could you help me understand that a bit more? Or what is that? Or look it up on my phone if they spell it out. So, yeah, but that's what we do in the treatment room. There is a foundation of knowledge that you will need to be successful in on the MBLEx. So some of understanding how to understand these words and the conditions and how it might affect your session is how it shows up on the MBLEx. So for now, I'm going to say, see you later for the recording. I'm going to hang out with these peeps right here, answer some more questions because there's plenty coming in the chat. And so I wanted to just remind you, my name is Jody Scholes. I'm your instructor for the MBLEx review course. Happy to be with you here each week in our live classroom. So see you again real soon.